Meeting. This is the Internal Scrutiny Committee of Lancashire County Council, and it's March the 5th. I'm just going to pass over to Ms. Ball for a few house rules. Thank you, Ms. Ball.
Thank you, Chair. Good morning, everyone. Welcome to members of the Internal Scrutiny Committee and also to any viewers who have tuned in this morning. As this is a virtual meeting of the committee, please bear in mind that there may be unforeseen technical difficulties. However, we will aim to keep these to a minimum and we have technical support to hand. Members, please ensure that your microphone is muted during the meeting and only switched on when you are speaking. Any members joining the meeting today using a mobile phone can mute and unmute by pressing *6. This will ensure that any background noise in your location will not be picked up throughout the meeting. After each item has been presented, the committee will be asked to indicate whether they wish to speak by raising your hand using the facility through Teams. Thank you, Chair.
Thank you very much, Ms. Ball. So do we have any apologies?
No apologies, Chair.
Right. Disclosure of pecuniary and non-pecuniary interests. If members have any, if they could indicate by putting a note in the chat bar. No? Thank you very much. Minutes of the previous meeting for noting, they're on page 1 to 6.
Note those, Chair.
Thank you very much. Okay, well, this morning's main topic is staff and wellbeing, and we're very fortunate to have with us today several people who I'm sure will give an excellent presentation on behalf of their particular sections. First of all, of course, we have the Cabinet Member, Sean Turner, who is the Cabinet Member for Health and Wellbeing, Deborah Burrow, Head of Services for Human Resources, Andrea Smith, Public Health Specialist, and Karen Smith, no relation, I believe, Team Leader, Employee Support Team. So they're going to make this presentation, and we're going to have some slides up shortly, which you should be able to see quite clearly. There was a problem with them to begin with, but I think that's all been sorted out now. So really, without any further ado, can you start now and make the presentation? Thank you.
Yeah, thanks, Chair. If I can just introduce, not a lot for me really to say, other than this is a great piece of work, as you'll see with the slides. We started on it some time ago, realising the need to beef up staff wellbeing and support and resilience to make the workforce more resilient. But then along came the pandemic and took us to a virtual world and changed the goalposts somewhat. And the work that's gone on, I think you'll see, has been phenomenal. So I'll pass over to Andrea, Karen, and Deborah to give the presentation.
Thank you. I think Deborah's going to start. She's Head of Human Resources with the presentation. I think that's correct, isn't it?
That's correct, Chair. Thank you.
Thank you.
Thanks, Mishba, for navigating us through the slides.
Deborah, are you using? You're not using a headphone now. If you could speak or turn your microphone higher, please, because the sound quality is quite poor.
Right. Okay. It may mine's as high as it can be. If perhaps move a little bit closer, if that helps. Can everyone hear me? Okay.
Yeah, I can now. Yeah.
Okay. Thank you. I probably just needed to raise my voice a little.
Yes. Okay.
Okay, thanks. Next slide, please, Mishba. Okay, well, thank you for the introduction. And part of this was to give you some information about our sickness absence levels during the pandemic and compare them before the pandemic. So this first slide shows you absence levels in blue in 2019 and absence levels in orange in 2020. The period at the bottom is between March and January, because essentially that is the period we've been living through this pandemic. So March 2019 to January 20 is the blue, and March 20 to January 21 is orange. And you'll see there that it actually is a reflection of us working and living in very different times. And we had a number of staff who were shielding in the early part of the lockdown. We also ourselves were in lockdown. So the incidence of absences, I think, is reflective there that because of the way we were living and working, it has actually lowered absence overall in the comparison with the previous year. Next slide, please. Thank you. This slide shows you actual COVID absence, which is at the blue line at the bottom, and then other absence is the orange line, and then the combination of the two is the grey total absence. Those levels do reflect the national position. You can see from March where it was quite high, it levelled off over the summer and then started to rise again in the December and January. So our absence levels have followed that national pattern. Next slide, please. That's just another illustration to show the orange is other absence and the blue is COVID absence. And again, it's just another illustration that you can see at both ends of those charts where we've had the peaks of COVID related absence and where it levelled off over the summer. Next slide, please, Mishba. Part of the presentation was also to give you some information about how we've been supporting and recognising our staff during these difficult times. So I've just set out here some key things that we put in place in response to the pandemic. The first thing we did was provide access to information and guidance. We felt it was really important that the raft of government guidance coming at us quite quickly, certainly from last March, was important to have on our intranet a go-to place for staff to be able to actually see that for themselves, get information about what that meant in their employment. So we weren't actually interpreting the guidance, but clearly that guidance in itself, for example, shielding staff and how we had to make sure that we could provide advice to managers in response to queries they would get. And we've kept that under review and built that up over this last 12 months or so. We've also clearly had challenges with our staff who have had to remote work and homeschool. And, you know, thankfully, we're moving out of that phase now, but that has created quite a lot of difficulty in balancing those two things. So Andrew will probably touch on in terms of the support around the mental health issues that can cause. But in terms of practical steps, our learning and development colleagues have put on particular sessions to provide hints and tips on how to manage that. Also, support from working from home. We've had lots of staff working like this, very different way of working. So we made sure we updated our risk assessment process to make sure that was robust for staff to be able to assess their safety at working at home and being equipped to work at home. We also have provided chairs and equipment from the county hall and other places. And we've also allowed staff where they needed to buy their own desk for work, a contribution of £85 towards the cost of that. It was really important for us to make sure that we were able to equip staff as far as possible. We've also signposted them to the HMRC tax relief, whereby you can just go on a link and go through the process to be able to get some tax relief on using your utilities during the time whilst working at home. There's also been some recognition presented to our staff in recognising how we've all had to cope with living and working in a very different way. And so all council staff have had additional leave, 2 days leave, a day to take in this leave year and a day that they can carry over. And everyone was entered into a prize draw over December and January, over 12 days, great prizes randomly drawn, just to recognise the efforts that staff have put in during this difficult time. We've also been encouraging staff to make sure they take leave, whether you're on a frontline service in social care where you do need that respite, or whether actually you've been shielding for a while and perhaps haven't thought about the need to have leave as well. So we've set in place encouraging staff to do that, and managers have done that. We've also just recognised recently, though, that we are coming up to the end of our leave year, and services are maybe struggling to allow all that leave to be taken if there's more than 5 days carryover, which is our standard. And so heads of service have actually got a little bit of flexibility to allow staff that flexibility to carry a little bit more over if they need to, just to help balance the service with making sure staff still take leave. And then finally, in the past, we have provided flu vaccination on site in offices, whereby staff can go along and have a free flu vaccine. Clearly, we've not been able to operate like that this year. And so where staff have been encouraged to have the standard flu vaccine and they've been reimbursed for that. So that's a summary really of how we've tried to make sure we support staff during this time and recognise the efforts that they've put in. I'm happy to take questions at this point, but the next slides are then on to Andrea and Karen.
Yeah, I was going to suggest that we have a break for questions if there are any, and if members have a question, it would help. Well, Carl's already done what I was about to say. It would help if you just put your hand up, and then I'll be able to take them in the order that the people have asked. So I'm looking now. Carl is first. So Carl, please go ahead.
Yeah, thank you, Chair. On slide 3, I think it was. Can we put it up on the screen, do you think? No, it's the one before that, sorry. Oop, that one there. On the left-hand side, where you've got your 5,000, 1,500, 2,000, are those hours that have been lost? You're saying there's been 1,500 hours lost. Is that per week or per month?
It's the incidence of absence, so it's the number.
Incidents.
Yeah, it's the, so where that 500 is, that would be 500
people
at incidents of absence.
When you say an incident, you mean a person?
The number.
Yeah.
So that would mean, so if I could just say, so if I was off sick today, that would be an incident. If I returned to work on Monday and then I went off sick on Tuesday, that would be a second incident, but it would be just one person.
Right, okay. So we don't know how many times a person's been off because it's all rolled into one, isn't it?
Yeah, it is a reflection of that,
yes.
that number, just to show the difference between that compared to non-COVID absence.
Right, so if a person's been off for a month, is that counted as one incident?
Yes, if it's continuous.
If it's continuous, yeah. So 1,500 incidents over a period of a month, 2 months, 12 months?
Yeah, well, that's charting that for that month in March, which obviously was a peak in terms of the pandemic, is showing where that spike was. So each dot, if you like, is the representation of the number for that month.
Yeah, so yeah, it's over 11 months. Yeah, okay, that's okay. And is there any way that you could identify those differences between people who are working from home and the people that are still in work in County Hall or in the offices that we've got scattered around the county? Is there any way that you could distinguish which is which?
In terms of the levels of absence?
Yeah.
We haven't got that analysis. What we would have to do, because we report it as employee absence rather than what job they do, but we could certainly look at further analysis on trying to differentiate between the different types of jobs that we have across the organisation that would show whether you are working more in an office-based environment to frontline service. But we haven't got that data here today. This is representing all absence.
Yeah, it would just be interesting to find out if people who are working from home, the absence has improved compared to people who are still in work who have days off. That's all I was thinking. Okay, thank you.
Thank you, Carl. I actually had to go into County Hall late March last year because I could see I was going to be working from home for quite some time and I needed papers from my desk. And I was the only person on Christchurch precinct on the floor 2. And I looked across to the room where Democratic Services are, and there wasn't a soul in there. As I went through the building, I was the only person there as far as I could make out. There must be other people, but I didn't see anybody else. And I think the vast majority of people had already started working from home then. Steve Holgate next, thank you.
Thank you, Chairman. My question is related to the level of incidence of sickness or time off work, and how it relates, what type of sickness it is, because obviously mental health issues are significantly affected by this pandemic. It gets to everybody, I'm sure, even if it's just a bit of cabin fever. But do we have the data that would enable us to determine whether the levels of sickness are increased in a particular, whether it's a physical illness or whether it's an illness brought on by mental health and stresses of that nature? Because it seems to me if we're going to create a robust protocol going forward, it would be useful to have that type of information, what type of sickness that has caused this particular absence. Thank you.
Yes, our top 2 reasons for absence haven't changed during the pandemic. So mental health related absence and musculoskeletal absence remain the top 2. We did see a spike in mental health absence around April, May last year, which I think is reflective of the challenges we all faced in living and working in these times. And that levelled off as we moved towards into the summer. But there has been a spike compared to the previous year in mental health, but it remains the top reason for absence. So, and Andrew, I'm sure will pick up why it's been even more important to provide that support in that area.
Right, that was where my next question was going, so I'll leave that, because obviously if there is a spike and it's recognised as a spike at the time, then there must be some kind of reaction from yourselves as to, you know, how to try and support people in that particular situation. Thank you.
Thank you, Steve. Erica Lewis, please.
Thank you, Mr. Chairman. I think these questions are appropriate given the presentation we've just seen, but if they should be picked up by somebody later, please feel free to refer. We've talked about sickness absence a little bit, and I was wondering about approaches to long COVID. I know that there have been some concerns raised by trade unions, in particular Unison, about the application of the sickness absence policy and how people suffering from long COVID might actually discover that their employment has been terminated. And so I know there is a push to have long COVID recognised as an occupational disease. I know, obviously there was a particular risk to our staff as key workers in that we asked them to keep coming to work. We asked them to keep working in dangerous circumstances, obviously with appropriate protections. But it would seem that then being sacked, but due to long COVID, is a not very generous response to outstanding service. So I wondered if you could speak to some of our thinking about long COVID and sickness absence treatment going forward, please.
Yes, it is actually quite a topical discussion at the moment, as you can imagine. And I work with a network of HR colleagues, and it's a matter of discussion that we've been having. But also, excuse me, I've been talking with our trade unions, and I think that at the moment we know little in terms of clinical information about the greater impacts. We know that there are statements about extended symptoms, the core symptoms of COVID, but the potential is that it can go further than that. What we have done so far in the council is advise our services that for someone who's absent due to long COVID, don't count that towards the trigger levels that would be triggered due to the certain number of incidents of absence. Also be sympathetic to the fact that we need to support our staff and help them find out more about how they can be supported with a condition that can be very different in different people. Certainly we would want to start having conversations with our public health colleagues about how we better support that as an employer, how we help staff be signposted to whether it's a COVID clinic and what the COVID clinic can provide. So I think our thinking at the moment is doing our best to find out more about how we can help the employee help themselves in terms of trying to get that clinical support, because that's the best chance of getting them back to work. It isn't about focusing on, if you can't come back to work, then your employment will be ended. That's not our approach generally to sickness absence. It is about trying to get staff back into work and what we can do through our occupational health and public health to do that. So that's where we're at the moment, and it is a developing area that we need more information on.
And so thank you for that information, and the acknowledgement that you are working with unions on it. I guess for me, there's a little bit of a disjuncture there between what you've just said about working to get people back into the workplace and what unions are telling us in terms of people being dismissed on sickness absence while they're still waiting for their occupational health assessment. And, you know, that doesn't seem to be a just way forward. And I guess I should note that the English HR system deals with sickness absence in a very different way to the Australian HR system. And I find the English approach entirely barbaric. So this is an issue that cuts deep with me, because it just seems that we, take a working life from somebody and dispose of them when they get sick if they get sick towards the end of that working life. And, that's not necessarily specific to you, but specific to the entire English HR system, which just seems to put a focus on people showing up even when they're sick. Like the focus is on presenteeism rather than productivity, and the way that many organisations treat sick staff, I just find horrifying. So I guess I would just encourage you to continue to have those conversations with trade unions, and to think, and if the report about people being terminated while they're still waiting for their occupational health assessments, and thus kind of being cut off from ill health retirement is true, that does seem to be a particularly unjust practice.
Thank you. Councillor George Wilkins.
Chairman, my question is partly an extension of what Eric was saying, but also on the statistics. Our blue light services are obviously fully equipped. I've seen the actual people in the white coats and the breathing apparatus, and I'm just wondering whether it's our staff who are at high risk, high exposure risk, and are we in fact monitoring those at a higher risk personnel? My main concern is the viral loading, of course, which obviously can happen for people visiting the elderly and people at high risk. I'm just wondering, rather than just statistics, are we in fact monitoring and helping those who are at risk of viral loading? Thank you.
Thank you. Just so I'm clear on your question, are you talking about those staff who are working in particular roles where they might be more exposed to the virus?
Yes, that's right. Yes,
Yeah.
Those are at risk of obviously meeting other people outside their own environment, and obviously people who have to visit other people in homes, etc.
Yes, yeah. I mean, Andrew could probably come in a little on some of the testing programme that we've got in place, and certainly the vaccine rollout's underway in those priority groups. As you know, the government cited particularly social care staff to be in the priority group. But absolutely, the risk assessment process that has occurred in those settings is very robust. It's identified how you manage to work in a difficult environment, what PPE is required, and so the services have gone through that with some rigour, got support through our health and safety advisors, our facilities management in terms of buildings access, etc., our public health colleagues, and there is a very rigorous testing programme underway where every 3 to 5 days staff are tested, particularly the lateral flow testing that brings out any asymptomatic staff, so that we can keep monitored that staff are protected, but also if they are infectious, we can protect others as well.
Thank you, George. So before we move on, I'd just like to say, speaking personally, throughout the whole of the lockdown, where I've been getting in touch with staff of various departments over the several months now, I've had exemplary service response very quickly indeed by the majority of staff. I've even had staff come back to me who said, I've seen your email, I'm actually on leave, but I can help, and come back during leave time, which I thought was really good. And there's only just one department that's been rather slow, and I've had to take that up, but everybody else, it's been really, really good, and I can't praise them enough. So I think, Andrea, are you going to be next on this presentation?
I think I am, yes.
Okay, fire away.
Okay,
Yeah.
lovely. Lovely, thank you very much. So this is our first slide. So I'm presenting with Karen Smith, and Karen is my team leader for employee support team. So the employee support team sits within public health, which is obviously, as you know, under Dr. Sakthi Karunathi. So I think, well, what a busy 12 months it's been for certain as well. And obviously, as a public health team, whilst employee support does sit within public health, it has been largely kept out of the coronavirus response, and therefore has been able to dedicate its work and its time to looking at corporate wellbeing, as is its remit. So a lot of us, obviously, within public health have been very actively deployed, and it's been a very different year, and that's been the same for a lot of our staff. They've been within their own services, but deployed doing alternative roles. And so we've been very mindful as well that a lot of our corporate wellbeing response has been to assist people both with the implications and the restrictions of lockdown, as well as the call for help for both voluntary working and alternative deployment, and also for those who have been dealing with with isolation, mental health problems, staying at home to self-school with children, additional shielding and caring responsibilities. And I suppose overall, really from a corporate wellbeing point of view, I just need to reiterate what Councillor Turner said at the beginning, in that there was a lot of work already underway, and a lot of provision already being developed and in place, and some of that started with the time to change work that Angie Ridgewell and Councillor Turner sponsored and highlighted as we got underway with mental wellbeing and bringing that to the forefront for LCC staff. And a lot of that was around supporting managers to support their team and supporting the supporters, so those people who were key contacts within teams and key go-to services. So that's where we were as a starting position. It was quite strange at the beginning of lockdown. It almost seemed like we were closed for business in some ways from employee support. We saw a regular inbox go very quiet. I suppose if we look back 12 months, it was a bit of a novelty at the beginning that we were all at home and not able to come out and go to work. The sun was shining. We went through a lovely spring weather. It was a bit of a honeymoon period before we really started to think think personally, what are the effects that this is having on me as a person now that it's taking a bit longer to get going. So we were quite quiet from a responsive point of view as a service, but that indeed gave us a lot of time and an opportunity to look at prevention and being ready to assist people and go out and try and find out where any issues were arriving. So we did look at some staff engagement and intelligence. We put together within public health and with learning and development and other colleagues across other services, a staff survey, which was a quick pulse survey, and this was done in June 2020. And we used the outcomes of that and some of the sickness absence intelligence that you've seen that Deborah's presented, plus some of the anecdotal information from our employee support team. To assist us in understanding what the messages should be to reach our staff. We have wellbeing volunteers in site as well, and I'll talk about those in a bit more detail later on. But they were able to provide us with information on the ground in teams because they have a reach into teams at different levels of the county workforce. We also were building on work with the HR policy review, with organisational development work, and with the business improvement journey and staff experience board. And as well, I think Deborah mentioned that there is a regular safer working group as well that has met throughout the pandemic to consider workplace welfare and employee welfare. We have recruited to our full cohort now for our employee support team as well. And so we've now emerged from the last 12 months with a full team. And generally in public health, we're working with the county's core services very collaboratively as part of some of those areas of priority work. So HR, L&D, occupational health, health and safety, communications, we're all in there rolling up our sleeves and trying to make all our work come together. There was some, I have got some information from, if I just bring up another file on my computer. We did some of the highlights from the survey in June was that a majority of the people who engaged in the survey reported that they were feeling useful. One of the questions was to understand whether people were feeling alone at home, whether they were engaged in meaningful work, because as you recall, I mentioned that there was a change in deployment for some people. And so it was useful to hear that most respondents said that they were feeling useful. And significantly more people suggested their work-life balance was better than before the pandemic compared to those that suggested it was worse. 2/3 of staff reported that they received adequate communication and felt supported by their line manager, which if you consider the shift of being in amongst teams, working at a desk, to us being spread all over the county and further beyond, was a real credit to the way that managers and teams responded in terms of keeping in touch. And indeed, we did see lots of encouragement, as Deborah mentioned earlier, to have virtual meetings, not just to go through work, but just to sit with a brew and connect with people. So that's been vitally important, and I know that that still exists today. There was a level of consensus across every directorate regarding the issues that were causing significant concern, and they were mainly personal issues, so work-life balance issues, people's physical health, isolation and lack of contact with colleagues, and mental well-being. The day job actually became a second biggest concern. So the changes in workload, communications, training, unclear roles. And if you consider what we were going through at that time, I suppose that was to be expected, but also useful intelligence to be able to work with. We also had some forming of community hubs locally in the 12 districts. And again, we used the volunteer workforce that we had, and we engaged with them to assist us, and we assisted them with support. We engaged with counsellors, and also we had some anecdotal information that we were, as a public health team, receiving in terms of the pandemic and its effect on the population. So Ms. if we could have the next slide, please. Okay, thank you. So what staff and managers told us and how have we responded to these issues? So as I mentioned, working from home and work-life balance, home working and homeschooling, as I'm sure we're all aware, adapting to that change and also COVID anxiety, supporting frontline staff, vicarious trauma, so things that people have witnessed and the impact it's had on them. And again, social isolation, isolation generally and loneliness and keeping connected, mental health and mental well-being. And also basic equipment needs, DSE arrangements, and sometimes the frustration of ICT and being able to connect with people through that. And Deborah did touch on that as part of some of the safer working groups arrangements and health and safety and some of the measures that have been put in place corporately. So obviously working with core services, we've done a series of blogs. I'll let Karen speak to you in a moment about some of the blogs that Karen has been involved in. Working from home, work-life balance, stress, fatigue and burnout, self-care, recognising when it's not enough and where to go for support. And also, we've been working with colleagues in organisational change and L&D in developing some really useful courses for both managers and new managers whilst prioritising wellbeing. And one of the aims of that was staff engagement sessions and encouraging them to develop those and have a more consistent approach from different managers across the organisation regarding the different approaches to wellbeing for staff. We also encouraged manager wellbeing as well, and we covered some top tips for handling emotional reactions to change so that they were able to enable their staff. Karen, is there anything you want to bring in at this point on either of those issues?
Just to elaborate more on sort of the blog style communications, really.
Karen, before we go on to yours, I think there's one question up for Andrea, and I also want to speak. So can we just have a break there? We ask any questions, and then we'll come back to you if that's okay with you.
Yeah, that's fine.
Thank you very much. So Andrea, first of all, I owe you an apology. When I introduced you, I should have pointed out you are a public health specialist. I do apologise for that.
That's no problem.
George, you have a question, apparently.
Yes, Chairman. Good morning, Andrea.
Hello.
What I'm really concerned about is obviously the mental health issue of not just the 25,000 people who work for Lancashire County Council or the 25,000 people who are in need of adult social care, but on the wider scale. Is there a point where obviously you must be looking to the future. Is there a point where in fact we can't go on much longer not having people in the workplace? Is there a point where you feel that people who are in need of adult social care must have social contact? From my own perspective, I still have Christmas presents here in the corner of the room waiting to go out to people who obviously I haven't seen for months on end. Now, I'm not at my wit's end because I can keep busy, but not everybody can keep busy. And I'm just wondering, from your perspective, being the specialist, is there a point where we in fact must say people must get back to work, we must have social contact, because in the longer term, the mental health issue outweighs the potential of getting COVID?
Thank you. I should just say there are a couple more slides to come, and I will be talking about the mental well-being and the plans that we have for the future. So, but just on this issue in particular, I think we recognise that social contact is really important. I know that there is a hug timetabled into the roadmap, and we are supposed to be getting advice on when that can happen again. As part of the Safer Working Group within our corporate teams, we are looking at how we start to bring people back into the workplace, how we do that safely. And there are already measures in place, and there have been throughout COVID. And we've all worked together, as I said, as collaborative services to ensure that those that are suffering and struggling with mental well-being have been enabled to come in throughout COVID to make sure that, you know, that they are able to keep safe and we are able to, bring them into an environment out of their own home and out of that isolation and provide some structure for them in a COVID safe way. So yes, I do agree with you there.
Thank you. Steve.
Yes, thank you, Chairman. Very briefly and elaborating slightly on Georgie's point. Obviously, the key to providing support is to knowing who needs support. And I do know that in Chorley they've created an integrated referral unit that works alongside public health, and we had a briefing from them only last week about the work that we were doing, and it seems to me that that's a process that has developed and is developing even more quickly under COVID and lockdown conditions. So my question really is there, are we learning about a bit more best practice and other ways of finding out who needs the support and then signposting them or giving them the advice and referrals that they need as a consequence of this awful disease that we're having to deal with? Thank you.
Yes, we have a number of referral mechanisms. If I just talk about those first. We have put out a lot of information, both externally, so that people who are not connected to the intranet can view it from smartphones from home. So that's something that we did newly. We have that's accessible through the website, but takes you into a safe and secure area for staff, so you don't have to be connected to an LCC system to access that. We have our wellbeing volunteers who are connected with teams on the ground, and their business, if you will, is about working within a team and providing information that's required and providing signposting, making every contact count. And again, we're educating and supporting our managers to do the same, and our heads of service, and all the way through different layers, as well as you'll know, the information that we've put on See First for counsellors and outreach as well into schools team, which has been something new that we've done over COVID. We're always willing to learn more, and we're always looking as a team to learn more. Within my team, my workplace wellbeing extends into external businesses as well. So we definitely share and learn from across the county and beyond. I work very closely with the Lancashire Enterprise Partnership, with Active Lancashire, and we're integrated into a European funded Business Health Matters project, and the Seed Alliance as well, which connects with the universities. So very much connected to learning on a wellbeing point of view, and what we learn externally, I try to bring internally to flavour the and build our response for corporate wellbeing. I hope that helps.
Thank you. Okay, well, that appears to be all the questions there. So we move on. Sorry, we move on to Karen, and Karen's the employment support team leader. So Karen, I'm sorry I stopped you before, but I thought it was necessary to allow Andrea to answer some questions. So if you now speak and say what you were going to say earlier, thank you.
Thank you, Chair. That's fine. I was just going to elaborate a little bit more on the blog style way of communicating with staff. We wanted to adapt a more engaging way in terms of which we were communicating with staff on wellbeing issues. So we thought we would develop, in response to some of the concerns from the intelligence that we got and what managers and staff were telling us, from the various streams that Andrea discussed previously, that we would focus in on some of those priority messages and develop a conversational style blog that would enable people to engage and reflect on the circumstances for themselves, and then include resources that they could look to consider to improve things and help them support them in particular issues. So we did a series of those that Andrea has mentioned, but they were working from home. This particularly focused on working from home and work-life balance, and the pressures that staff were communicating to feel always available as a result of working from home. And we engaged them to sort of reflect back on life at the office, and would they really worry about being available to respond to that email instantly if they were chatting to a colleague at the photocopier, for instance, for a few minutes. Would that same feeling of guilt and anxiety about being away from the screen come to mind then? And we kind of we understood that the answer to that question for the majority was no. And through the communication that we got back and the comments, were people found that really, really helpful to help them put some perspective on what the expectation was from them working from home and working in the office. And how, you know, that there is a support there to actually allow themselves to take those breaks and be away from the screen as they would do if they were working in the office. And similarly, the messaging style continued for things like stress, fatigue and burnout. Self-care has been really important, and a message that we have promoted throughout the pandemic, well, before, during, and will continue to do. Because essentially our well-being starts with ourselves, and that's the message that we want to promote throughout the organisation and continue to do that regularly. We've developed some resources around that as well. So we have a self-care evaluation sheet that's available to all staff so they can check in with themselves around their own well-being with a view to improve it. And we've also done some similar styles, blogs and messaging around parenting and homeschooling that linked in with the offer from L&D colleagues as well. That was a collaborative piece of work to respond to support our colleagues across the organisation to continue to work to capacity and homeschool their children. And that also contained resources of external support as well as the stuff that was available internally for them, to help them continue to support themselves and the children whilst they're doing that. Andrew, do you want me to continue on some other things? Do you want to pick up again on it there?
Well, I'll just carry on with the next comment. Thank you, Karen, for that.
Okay.
So adapting to change and COVID anxiety, what we felt here needed to happen was a different style of communicating, as Karen has already mentioned. So regular staff messages, providing advice and support, and signposting to a range of topics as they came up. We also linked with national campaigns around mental health and mental well-being. And as I mentioned earlier in response to one of the questions, we looked at how people accessed information, and we had the lancashire.gov.uk/staff link, which people could access all the information that was on the My Wellbeing, which ourselves, Comms and other services worked very hard to refresh. And we also had the new Facebook for Lancashire County Council staff as well to feel connected. So we've been supporting work with our public health colleagues as well to enhance the digital offer and the availability of quality digital health apps for our teams, and we've been promoting that through our wellbeing volunteers. So we did mobilise the LCC Wellbeing Volunteer Programme. No, you're all right to go on to the next slide. That's fine. Thank you, Ms. And as I said, this is something that we'd already started prior to COVID. But obviously, because we were all becoming home workers, or a lot of us were becoming home workers, it was it enabled us to get that reach into teams in a quicker way, I suppose, in a more effective way. So the Lancashire County Council's vision for our wellbeing volunteers is to create a supportive culture of wellbeing where staff can flourish. And as you can see, every week we do an email out to wellbeing volunteers, and we have a large cohort of those now. And this is some of the feedback that we receive. They feed back to us on a regular basis, and they inform us about what is important to them, whether the resources that we're sending out to them are useful, how they've used them, and also what good ideas they've got, so that we can bring those back and circulate those through other teams. And we've brought them together as a forum, and we've got plans to do that again. So we're all learning from each other on that. So some of those comments there, I'll leave you with those while I tell you a little bit more about the Wellbeing Volunteer Programme. So it's a network of staff that can support each other's health and well-being, and also raise awareness of the support and information of what's available on the many topics that can affect both staff at home and at work. And this is for whether they're managers, there are all levels and all types of areas of our services across LCC. So we want to make sure that everyone has access to information and support where they need it, that they know where to go. And as I said, we've made those places to go wide and varied. You don't even have to be in work to view those resources. And we want to reach into staff areas where we know staff have more limited access to the intranet. That is obviously where we are prioritising and targeting our work. We have 160 wellbeing volunteers spanning the whole organisation. And we did a SNAP survey for those in December, and the first findings were that the first 30 responses yielded a reach into the organisation of over 3,566 staff. So that's a really good start to that piece of work, which we're obviously working hard to grow. We had a big brew in February around the Time to Talk Day, and Karen and Helen Wilkinson worked very hard on that. It was supported by employee support colleagues as well, and it was a good way to share ideas and examples of good practice, peer support, and exceptional work being done by the wellbeing volunteers generally. We're looking to see how our rollout of MS Teams can make the most of sharing resources. So there's plenty of work to do there. And obviously we feed people back, and it's an education program as well, because we feed the wellbeing volunteers back to the resources that we're constantly developing. We tell them about the new training sessions that are coming out of L&D. So if you miss anything on the intranet, you can hopefully pick that up through the wellbeing volunteers. And obviously we've done some other work as well in connecting staff. So the My Health and Wellbeing site has now got a very large click feature on the first page of the intranet. We've translated that information for school staff use, and that's the first time we've done that. We've worked very hard with the school's HR team to do that. There was a lot of pressure on the team to turn that round to be able to support school staff really quickly. And again, we've done something similar for that for county councillors and tried to shape that to assist yourselves as well. And as I said earlier, in response to one of the questions, I work on with external partners around bids locally around getting shared wellbeing messages out to small and medium-sized employers, and looking at business health matters, which is a piece of work with Active Lancashire. So we bring all of that internally, and we've worked very closely with the NHS and Lancashire and South Cumbria Hospitals Trust. So in supporting our, let me just see, I think we're on the next slide. Could you just, yeah, thank you. Support to frontline staff. We've got a lot of information on that we can give you. I suppose Karen is best to report on this because she's recently been to a adult social care webinar. So Karen, would you just like to give a little bit of information on that, please?
Hi, thank you. Yeah, we're really looking to focus in on developing the support for the whole organisation in relation to wellbeing, but the priority for that is our frontline staff. We want to focus on resilience, mental health and self-care, and where support can be accessed, including LCC resources and signposting to organisations and charities. We've attended to promote this message and bring people on board. My colleague Helen Wilkinson and I have attended a number of webinars with adult social care providers and also the Social Work Academy to raise the awareness of the wellbeing resources that are available for staff, and also to raise and extend our wellbeing offer. As a result of some of those webinars, we've now met with 5 heads of service and 1 director within adult social care, and have set up individual meetings as a result of that with their service individual service team managers to look at what the wellbeing needs are in their team. We'll be going out to raise awareness of wellbeing directly with those team members and offer mentoring and support around specific wellbeing issues to help that improve the wellbeing of the team overall. So that will be a bespoke offer and tailored to the needs of individual teams, so we can look at specific areas of concern. It might be stress, it might be anxiety, it might be burnout and fatigue. It might be that the team's doing really well and how can we build on that and keep that resilience in there. So that's one of the creative ways that we're looking at progressing those messages through the organisation. In addition to that, we've also developed support packages for our volunteers and community hubs. There was an ask came in on how we could provide support to our provider network that aren't they're providing the care and support that Lancashire County Council commissions in our care homes and community care homes on older people's services. And we've engaged with them to ensure that wellbeing information and support tailored to them that's accessible to them is available. And we've done the wellbeing presentation to that group of people as well, which incorporated 400 plus care home representatives within the provider network. Let's move on to vicarious trauma. Andrea, are you going to pick that up?
Yes, yeah, well, I just want to say thank you for that, Karen. I just want to say we really have corporately managed to flex and change depending on what the issue has been as part of the pandemic. At one point, you may recall, we had a temporary morgue being primed and ready to go should the need arise. And obviously, in order to have that facility up and running, staff had to be aligned to that. And the employee support team, alongside other services, put in a support package for staff at that temporary morgue, obviously recognising the nature of work and the potential trauma that they may have to deal with, and potential triggers as well that may be in their own mental, that may affect their own mental well-being. So which kind of brings us neatly onto the vicarious trauma and the wellbeing trauma support. So we've worked alongside LSCFT in developing the Resilience Hub, which some of you may have seen advertised across Lancashire ICS. It certainly has been on the front page of our intranet and is a Resilience Hub response with access to clinical psychologists for people affected by COVID, not just through work, but from the impact of COVID needed in all ways, really, as a workforce. And so I've worked with the psychology team over there, and as a result of that, we've been able to access that expertise and professionalism to support us in some of our work here in LCC, and it's work that we're looking to develop and establish going forward, which I'll talk about in a moment. And so we've been able to look at other areas of work which have a traumatic effect on people. We've been supporting domestic abuse workers and their support staff as well, and we've been refreshing our support and development for staff on that as well. So there's more to be heard from that in the future. In terms of isolation and loneliness and being keeping people connected, I've touched on this already on some of the earlier slides, but we've looked at different ways to keep people motivated and engaged and connected. We've had a good relationship with Lancashire Adult Learning, and we've put on free wellbeing courses with them. They've been during the day for those people who've been able to access, and they've also been in the evening and accessible, so you can self-teach yourself meditation, yoga, how to deal with being isolated, lots of different things. Also microwave cookery, so we also had some feedback of people obviously used to coming in using reflections, and now they could no longer do that, you know. So different ways of providing people with some really encouraging ways to learn. So that's been good. We've also worked with the libraries in supporting and raising awareness and participation in a pilot of theirs for Reading Friends programme, which supports work to reduce loneliness. So like I say, lots of different things, lots of different ways. Within public health team ourselves, we've had a virtual North Coast 500 walk where we've all joined work teams, and we've virtually encouraged people within the confines of the lockdown restrictions to get out and have a walk, and that was fun, and it really had a really good effect within the team to get people out and do things and feel connected as well. So mental health, obviously all of this touches on mental health, as there's no health without mental health. We've used and promoted Remploy. We push them to redesign their service for LCC staff by developing a virtual service, as obviously a lot of the appointments it did was face-to-face, and that service offers 9 months of support for staff with mental health. So we've been really developing a strong relationship with them as well. We've put out some additional support for staff, for managers supporting staff who may be feeling suicidal, and this has been promoted at various opportunities as well. Sorry, I'm just going to check. Yeah, and that's also available in the mental health guide. We've recognised that there's been support for staff with money worries. This has been a big feature. We've lined up with the welfare rights team, which is also within my remit as a public health specialist. So we've linked to them, and there's information there which is promoted for all staff around financial concerns, and again the information on tax relief for staff working from home. And again, we've touched on the ICT equipment and big areas of work around that. So there's more to do, and we know that we will have a changing emphasis, particularly on trauma, potentially on post-traumatic stress. And as I say, we have teamed up with professionals and colleagues outside of LCC to help us with the development of that. We're looking to put trauma at the heart of our workplace wellbeing, and for that recognition generally in our workplace. And so, you know, we're definitely looking at building a programme of work around that at the moment as we go through the recovery from the pandemic, and touching on earlier questions, how we encourage people to come in where they need to do, and maybe so that it isn't all home working, but that people can touch down in a safe and secure way that's respectful of the COVID secure guidelines that we have, and obviously the health and well-being of our staff, but also developing that connectivity in what is more and more a virtual world. We're developing a person-centred and a team-centred way of working. We've had a successful pilot with the community health team and employee support, and we're supporting staff and managers who are returning to that office-based working arrangement. We're continuing to do that. There's other work that we're on with as well in terms of the domestic abuse, and looking at services where they touch on very traumatic work. So we have domestic homicide reviews at our adult social care and our children's social care, and also child death overview panels, and how we put in help right at the forefront of that work rather than picking up the pieces and assisting people afterwards. So really the preventive element of that. Karen, is there anything else you want to add before we step aside for questions?
No, I think that's everything covered, Andrea. Thank you.
Okay, lovely. Thank you very much for that, Karen. So I suppose really all of this builds on our values and behaviours, being supportive, innovative, respectful and collaborative. We're continuing to have that cultural shift to use the talent across our organisation, within our services and within our staff, through our wellbeing volunteers and through our ways of working, in order to support our organisation with corporate wellbeing. And I suppose I've taken up quite a bit of time with those slides, but I make no apology for that. The team has been fabulous in reacting and flexing to the pandemic, and working with colleagues across the organisation, and I think you'll get a flavour. I could talk for another couple of hours on this, but I won't. I'll become a wellbeing bore, so I apologise for that. Thank you, Chair.
Thank you very much indeed. I've got a question from Councillor Wilkins-George.
Yes, thank you, Chairman. Chairman, first thing, can I just say how impressed I am regarding Deborah, Andrea and Karen. We're very fortunate to have a very progressive team on board here, and they've certainly kept me well informed, and I'm very impressed by the work. So well done. Also, one thing I would want to mention, I think Andrea did skirt regarding the museum staff and our volunteers, and also our library assistants and volunteers generally. I hope they're being kept in the loop as to what we're doing, and also being progressive in having them on board when the spring back comes. And a little pun, if you don't mind me saying, that the Jabs Army are absolutely fantastic as well. I've actually seen ex-councillors running it. They're really fantastic people there, and a pat on the back to them if you've got the way to do it. Thank you, team. Thank you, Chairman.
Thank you, George. Councillor Lewis-Erica.
Thank you very much, and thank you for the presentation today. I know lots of councils were working on some of this wellbeing stuff before the pandemic, and I think lots of us have realised just how important it is, and that as with all workers who work in things that they are passionate about and things that they see a higher purpose in, our staff are particularly vulnerable to kind of overworking themselves and going that extra mile in order to help a resident, but not necessarily looking after themselves as much as they should. And so I think we all need to, councillors are also guilty of this often. I think we all need to make sure that we're taking good care of each other and trying to create the practices and culture that make that the right thing to do, rather than so it has to be led from the top. And I think we're doing some really good work on this. In that moment where I think we are doing some really good work on this, I just want to come back to and you talked about the engagement with a university and research and bringing in good practice and things like that. I just want to restate, my understanding is that there's a lot of conversations going on through the staff experience board about new ways of working and what the future of working will look like and how flexible working continues and all of those kinds of things. But my understanding is that our trade unions don't have a formal seat at that table. And of course, in terms of people who know what leading good practice looks like in workplace management, what in terms of having a network across councils in terms of what other people are doing, I think unions could offer a really useful voice in that discussion. And I understand that they've asked but haven't actually got. So I guess I just want to make a plea for their inclusion. And I think so much will change in our workplaces. I changed jobs in the pandemic. I still don't know where my office is at my new job. They just shipped me a laptop and I've stood here at my desk in my, spare room for the last year or whatever it is. And I think that whole discussion about, do people have to come back to the office? How do we support flexible working? I know there are some constraints in terms of councils, because obviously phones need to be covered and services need to be delivered. But how do we think flexibly about that? How do we think about things like the 4-day week? How do we think about actually, fundamentally rechanging how we look at works in ways that, facilitate people to be healthy, to be well, and to be productive? Because there's lots of research that tells us that, people who work shorter hours are in fact more productive. People who are rested and refreshed are more productive. People who are happy and well in their workplace are more productive. So it should be a win-win for all of us if we can work this through. And I just want to make sure that we're drawing on all the best sources of information possible. Thank you very much.
Thank you. Sean, I know you're indicated, but Deborah flashed her hand up, so I'm just going to take her in case she's got a comment to make on Erica's speech.
Yes, thank you, Chair. If I may, it was just on the comment with the trade unions. I actually had the joint negotiating consultative forum with the trade unions yesterday, and the staff experience board work is a standing discussion that we have. And I updated them on the discussions you've just described about new ways of working. What does that look like? And that is an area where they can be engaged with us. So you're quite right. They have asked the question. It's not taken any real depth of working yet. And I think, to be fair, that's probably because our Director of OD and Change, who chairs the board, is heavily redirected on the testing rollout, which obviously is community testing too. So it's just the timing of the how COVID has redirected resource. But absolutely, they are in the forefront of being supporting us and working with us, and we will engage them. Thank you.
And I think they'd like a seat at the table.
Thank
you.
Thank you for that. So, Sean, unless your question, I was going to bring you in at the end before the recommendation was read. So, have you got a question, or you just wanting to sum up? Okay, so I'll just say, first of all, it's fantastic that 3 officers with 3 different services got together, put this presentation before us today. It's been really good. It's given us a real insight into support that's been provided for our staff, and I thank you very much. It's been interesting and informative. So thank you for that, and thank you for the way the presentation went. Now, Sean, you'd like to sum up on what you've heard today and what you know about the situation. Thank you.
Yeah, no, it's just to say, as you can see, I think it's been quite a quiet year, as you'll notice. I just want to say a big thank you, really. The approach taken, flexibility's come up so many times. I think that's been really important, especially with the pandemic coming along. Erica said part of my comments about productive staff are happy staff, and I think that's been the aim to try and support those people, and so they are happy in their work. Like I said at the beginning, the pandemic came along and changed the goalposts somewhat, and that's where the flexibility kicked in. So really, really good work by everybody, which is, on top of the day job as well, completely aware of that. It's been a really testing time, but really proud of the response and the work that you've put in. And I think you all now, think the word busy should be changed in the dictionary, because we didn't know what busy was. Let's face it. And one special mention. What I was going to say first is you've shown that we've got a dedicated team in place for this, so it is something we'll take forward, and it's going to get dedicated time. We're going to so many, not just people to cover off, but so many issues to cover off as well. But we're working on that. But the special mention was about the microwave cooking that Andrea mentioned, and the special mention is this: don't knock it till you've tried it. Having had the opportunity to attend one of those courses, the food that the guy who was presenting the course for Lancashire Adult Learning was well, it makes me look at microwave cooking in a different light. I wasn't a fan before, but I must admit some of the stuff he knocked out was really good. But no, thank you very much, and I'll leave it back to you, Chair. I think Andrea wants to come in.
I was just going to say, or is it microwave, as Nigella Lawson calls it?
Whatever it is, it's not as bad as I thought it was.
Well, one piece of advice is do not try and heat shop bought poppadoms in the microwave, as I did the other day. It came out in tiny little crisps that were inedible, so don't try and do it. It did say warm before use, but it didn't say don't use a microwave.
I think we'll get you booked on that course, David.
They were really bad. So thank you very much for all of that. Now we move to the recommendation, which is the Internal Scrutiny Committee is asked to note the update, but also Steve has added something which is asked if it's okay. And Steve, since you put, I've got it in front of me, but since you put it forward, would you like to read it out?
Yes, thank you, Chairman. I do think the recommendation is adequate, but very perfunctory, and I think we need to elaborate a little bit. So what I'm suggesting is, after note the update, we add and recognised that the challenging and ever-changing environment staff are operating in, and the new best practice being developed as a consequence. Thank you.
And I'm happy with that. Has everybody agreed? Good, I hope so. Thank you very much indeed. And thank you for the presentation once again. It was really good. And thank you for attending, Sean.
Thank you.
We move on.
Everyone.
Thank you, Chair.
We move on to item number 5. Now, we've got, it's not so much a problem, but a situation which has occurred on this. And one of the items that really the main one for what was going to be the April meeting won't be ready in time, or at least it's doubtful if it'll be ready. But because of the election called and because of PERDA and because the information won't be available to us, I'm going to cancel the April meeting. I noticed that 1 or 2 other scrutiny committees are being cancelled as well, mainly because of PERDA. So we will cancel that meeting, and the next meeting will be after the election. Thank you very much for everybody, and thank you for attending. We've got no urgent business, and we've got the date of the next meeting, which would have been April, but we'll leave that into abeyance until after May. So thank you all for attending, and goodbye.
Thank you. Bye.
Thank you, Rachel.
It's been really good.
Thank you.